Hi, everybody. Welcome to Benzo Warrior Community Roundtable Zoom meeting. Today, we are excited to welcome Nicole Lamberson to speak with our BWC Zoom Roundtable. Her talk is entitled Mistakes Made in Withdrawal, including Protracted. She's going to talk to us about mistakes that people commonly make during their benzo withdrawal, including the mistakes that often happen once people are protracted, in hopes that we can avoid those common pitfalls. Nicole is a physician assistant residing in Virginia. She obtained a BS at James Madison University in 2000 and then completed her master's of physician assistant program at Eastern Virginia Medical School in 2004. She practiced in an urgent care and occupational medicine setting until severe illness from benzodiazepine withdrawal syndrome left her unable to work. In 2005, she was prescribed Xanax for work-related stress. Over the course of 5 years, she developed many classic symptoms of benzodiazepine tolerance withdrawal, which multiple psychiatrists misdiagnosed as so-called mental illness. This resulted in prescribed polypharmacy to treat the troubling symptoms of tolerance, including 2 benzodiazepines prescribed simultaneously, a Z drug, an antidepressant, a stimulant, and an antipsychotic. In late 2010, after discovering a magazine article authored by journalist Samet, experiencing similar symptoms from his prescribed benzodiazepine, Nicole was prompted to research further and made the connection between her own troubling symptoms and the medication. This was followed by her immediate decision to withdraw. Unfortunately, lacking the proper guidance or information at the time regarding the absolute need for a slow taper, she was negligently cold turkeyed in a detox center. This ultimately resulted in a severe and protracted withdrawal syndrome that persists to date. When symptoms allow, Nicole writes about benzodiazepines and their potential to cause severe and/or protracted withdrawal syndromes, and volunteers her time helping with ongoing benzodiazepine awareness initiatives, including Benzodiazepine Information Coalition and the Benzodiazepine Action Work Group of the Colorado Consortium. Nicole also co-founded the Withdrawal Project, and she does marketing, distribution, and outreach for Medicating Normal, the film. She's an associate at the Institute for Psychiatric Drug Withdrawal. She hopes to continue to use her lived experience to advocate for more education and awareness around benzodiazepine risks and harms, as well as for changes in prescribing and deprescribing practices. Other interests include the primal lifestyle. We are glad you have joined us for this event. Thank you, Nicole, for speaking with us today.
Thank you, Lisa. And thanks everybody who's here. I'm excited to talk to you guys today. Like Lisa said, the topic of my presentation is called Common Mistakes in Withdrawal and Post-Withdrawal or Protracted Withdrawal. And I'm just really grateful to Benzo Warrior for inviting me. I tried to use some of the Benzo Warrior colors here in my PowerPoint. And thanks to Benzo Brain, I had to watch like some YouTube videos and things to figure out all of the intricacies of making a PowerPoint, because I haven't done that since like grad school or something. So hopefully it works okay. All right, so about me, Lisa just read my bio, but I'll give a brief introduction of myself. I trained as a physician assistant. I'm not currently practicing. I don't maintain my medical license at this time. And so I'm not your PA. Nothing I say is medical advice, but I do have that training. It's also pretty obvious that, you know, I went to medical school and I was practicing as a PA, and I wound up in this position of being physically dependent on not just benzodiazepines, but polypharmacy and psychiatric drugs, because it wasn't taught to me in medical school, just like it wasn't taught to countless doctors, probably, that all of you have encountered in trying to get help for your own physical dependence and withdrawal syndromes. So I took these medications because I thought they were helpful or that they would help me, and I didn't know, and I wasn't given informed consent from the psychiatrist who gave them to me. So Lisa just read my bio, which was kind of a summary of my story. I always give a disclaimer that if anyone is sensitive to hearing about protracted withdrawal, this is probably your chance to leave, because I will talk about my story, and I do have a protracted story, unfortunately. I don't share it to scare people. It's just my truth. And I think it's important that we share protracted stories because other people are protracted and they need to hear that they're not the only ones. And also, if benzo withdrawal is just like a short-lived sort of, minor problem, then it's not really a big deal. We don't need to do anything about it. Part of the reason it's such a serious issue is that people can go on to suffer for many, many months and years post withdrawal. And so it's hugely important that we include it in our conversation. So as Lisa said, back in the early 2000s, I was prescribed Xanax. That was my first drug. Although prior to that, I had taken like Wellbutrin for an attempt at smoking cessation. And I don't remember anything ever happening with that. But Xanax quickly caused me tolerance and interdose withdrawal. I didn't know what those words were at the time. I didn't know what it was. I was just having work-related stress. I was 20 something and fresh out of PA school, all of the nerves and things that come with that. And I trusted the medical profession. My father's a physician. I had just finished medical school. I don't think at the time I was much of a critical thinker. I was more like just trying to learn and, get A's and regurgitate all the things that were taught to me. And so I didn't have any sense that like doctors could harm or that, if you start taking a medication, like what is the long-term plan for eventually you're going to have to get off of it. I didn't think about that at all. And so I just accepted the Xanax and started taking it. I became more anxious and started having suicidal urges and thinking, and that scared me. So I went to see a psychiatrist thinking, maybe I'm just having like some kind of a mental breakdown or something from too much stress at work. Or over the next 5 years of seeing that psychiatrist, I became the victim of polypharmacy. I was on 2 benzos. So, 0.5 milligram of Xanax twice a day, 1 milligram of Klonopin 3 times a day. I then got put on Ambien at bedtime, and I was on Remeron, Seroquel, and Adderall as well. And the last 3 were added, as is typically done when the benzo problems are misdiagnosed, and they add, another drug to treat the symptoms of another drug. So I think the Remeron was because the Adderall made me stop eating, and then the Remeron makes you eat, and the Seroquel because I was having like tolerance related insomnia. Anyways, I was like a mess of chemical soup on 6 psychiatric medications. I became pretty fully non-functional. I was struggling at work. I struggled to get out of bed. I was having agoraphobia already on all of those medications, and I didn't know what was wrong with me. Tons of like exploratory medical procedures, upper and lower GI scopes. I had rashes all over my body. I was having like steroid injections into my wrists and fingers because I was having excruciating joint pains. And all of this was toxicity from the polypharmacy. I didn't figure that out until Matt Samet wrote his story in Outside Magazine, and my dad happened to have a subscription to Outside, and he gave me the magazine article one day, and after reading it, I was like, oh my gosh. I mean, how, well, some of you who are in benzodiazepine withdrawal understand how like we can finish each other's sentences, and what he said just spoke so much to what I was experiencing that I knew that that is what it was in that moment, that I was being essentially poisoned by these medications. Unfortunately, adding insult to injury, I also didn't know about tapering. I didn't know that withdrawal syndromes could persist and be long lasting. And so I checked myself into a detox facility almost immediately after reading that article, because I, like any normal person, wanted these drugs out of my system. I thought, we'll just get them gone. And I was concerned about having a seizure. I did know that you could have a seizure from benzos if you stop them too soon. I had kind of a gut feeling though that like something is wrong about does everybody who sees a psychiatrist have to check into a detox center? Like, that felt weird to me. And that was like a gut feeling that I ignored and that I should have paid attention to. So that was one of the mistakes that I made. But I wanted off the stuff. So I checked in. As you can probably predict, I developed a severe withdrawal syndrome. I had akathisia. I was incredibly suicidal. I managed to stay off of the psychiatric medications. I was off of everything, even though the detox only took me off the drugs that they deemed, bad or quote unquote addictive. But they were happy to, pile on all kinds of other psychiatric medications like antidepressants and things. But I got home from the detox center. I wanted off all of it. So I just stopped everything. I lasted in that state for about 4 months of severe, agonizing withdrawal until I just couldn't take it anymore. And I reinstated only a benzo. It wasn't the initial dose that I had come off of, which I think is a huge mistake in hindsight that I made. If I had to do it over, I would have gone up much higher, closer to the dose that I had discontinued, but I was afraid of the benzo at this point. So I only went back on like 1 milligram of Klonopin. And it did help. It was enough to sustain where I didn't have to, end my life. I was at that point where I was, very suicidal. And then over the next 18 months, I tapered off of the reinstated benzodiazepine. So the detox was in October of 2010. I had 4 months off, an 18-month reinstatement taper period, and I've been off ever since. Everything. And I am in protracted withdrawal. I still have symptoms today in 2023. They have improved since the beginning. It's been like a slow, very nonlinear, gradual progression in my healing, but I do still have symptoms and am protracted. So let's see. Organizations I work with in this space. I serve on the medical advisory board of BIC. I am a team member at Intercompass Initiative, which owns the Withdrawal Project, which I co-founded. I am an associate at IIPDW, which is the International Institute for Psychiatric Drug Withdrawal. Some of you may have seen me over on Medicating Normals, social media, doing interviews over there. I do some of the distribution for the film as well. And I'm a founding member of the Benzo Action Work Group for the Colorado Consortium. I've been involved in some research. Some of it is currently ongoing. And now one really exciting thing I'm involved in that has just started is I'm a member of the patient panel that's working with the American Society of Addiction Medicine. They received the grant funding, the ASAM, from the FDA to develop deprescribing guidelines for benzodiazepines. So over the next few years, we are going to be consulting with the medical panel that is developing those guidelines and hoping to have some sort of influence over how they turn out. So fingers crossed that goes well. I guess we'll see in a couple years what kind of deprescribing guidelines they come up with. All right, so typical disclaimer, this isn't medical advice. I'm not encouraging anyone to stop or start psychiatric medications. The views I'm going to express today are just mine. They don't represent those of any organization that I'm a part of. And if you're considering stopping medication, you do need a qualified medical professional who is knowledgeable about safe deprescribing practices. All right, so part one of this, I'm going to talk about common mistakes made, the pre-withdrawal period, during tapering and withdrawal, mistakes made in post-withdrawal or protracted, mistakes made when you're reintegrating, so you're healing and you're getting back into life, mistakes made just overall. I had trouble sometimes putting mistakes in categories because a lot of them sort of overlap and, repeat themselves. Mistakes made with support groups like the online communities, mistakes made with others in your life while you're enduring withdrawal and post-withdrawal, mistakes that we can make with ourselves during this time, and then a couple biggest mistakes. And I put question marks there because it's the ones I think are the biggest, but I'd love input from anybody watching or in the comments what you think the biggest mistakes might be. And then part 2, you guys are welcome to come on and discuss what we talked about here about mistakes or ask me questions. I am happy to answer questions that people have of me about my withdrawal or protracted or anything you want to ask, as long as it's not personal medical advice. All right, so let's move into the mistakes made pre-withdrawal. I put this one first because I think it is the most important. If people can avoid problems in this phase, I think they can have the best chance of success for getting off of benzodiazepines and other psychiatric medications. I think sadly people wind up in the groups too late because they make a big mistake in this phase, not knowing any better. And maybe that's where our activism and advocacy comes in, because we want to reach people, before they embark on a withdrawal journey and make mistakes that sometimes aren't so easy to come back from. So if you're in this phase of pre-withdrawal, this is such an important phase, and you have a really good chance to minimize harm here if you avoid mistakes. So the first mistake would be panicking. I feel like that's what I did when I found out what was happening to me and checked myself into detox. It was like, oh my gosh, I want all of these drugs out of my system. Don't panic. Don't do this. You've been taking these medications, probably some of you, for a long time. There's no reason to rush and rip them out of your system. Number 2 is just do your due diligence. Take your time. You need to prepare in this phase. You need to plan. So you'll need to start doing some research. All right, what drug am I on? What forms does it come in? What taperable forms? Is it in a liquid? Is it in an extended release form only? Does it come in different sizes of pills, etc.? All of that is important information. You can read the Ashton manual. You can get in some of the support groups and look up tapering methods. There's all different tapering methods available depending on what drug you're on. So that's a decision that you're going to have to make. I think to truly get ready to taper, you need to maybe in some instances do some lifestyle modifications, figure out some coping skills and stress reduction. What tools are you going to lean on if you embark on the tapering and things get a little bit rocky, or you're having withdrawal symptoms? What kind of coping are you going to use? You'll need a support system, be it people in your actual real physical life or people that you find online who can support you. And then finding, hopefully, a withdrawal-wise or withdrawal cooperative medical provider. That last one is not a requirement. There are people who taper without them if they've educated themselves enough, but you will need someone to prescribe the medication in an ongoing way so that you can continue to take it for your taper. Another big mistake is telling your medical provider too much or the wrong information, or even using incorrect language. So if you run into your doctor's office in this phase and say, I'm addicted to Xanax, number one, that's the wrong terminology unless you truly have been abusing the drug or you meet, the criteria for having a substance use disorder. If you tell your doctor that, they're going to stop prescribing you benzodiazepines because they're going to think that you are addicted in the true sense. And most of them don't understand, the nuances between physical dependence and addiction. And so you'll have to explain those things in ways that they can understand. And sometimes just telling them too much, like doctors and PAs and nurse practitioners are very busy. And I've seen people sort of sabotage their relationship with the physician in this phase of things by just, going in with like long, detailed accounts of everything and saying like, I found these people online and this Ashton manual and this, like completely just overwhelming your medical provider to where they don't want to deal with this or want to sort of wash their hands of you. Next is just having excessive anticipatory anxiety or fear because of maybe seeing another person's difficult process. I see a lot of people comparing and, sometimes they're not even comparing apples to apples. I mean, everybody is unique. We're different people. We have been on different medications for different periods of time and different strengths. And, so just because somebody else is having a hard time doesn't mean as you're prepping for your withdrawal that you're going to have that same outcome. I see a lot of comments on YouTube, like they've watched a video of somebody having a hard time and they're like, well, great. Now I can't start my taper and I'm not going to do this because now I'm scared, I'm afraid, which is totally understandable. But keep your anticipatory fear and anxiety in check and realize like maybe that person who's having such a super hard time is, somebody who checked into a detox center or who tapered in a way that's totally different from what you're going to do if you're in this phase and you are not making these mistakes. You're planning ahead and really doing your prep work. And then not considering staying on for some people is a huge pre-withdrawal mistake, I think. Some people are not ready to taper. They may be having, a crisis in their life at this time. They may be elderly and super frail and sick. So not everybody is advised, I think, to taper in this phase if it's just not the right time. And then similarly, you can overplan. If you are just like a short-term or intermittent user, you might not have to do some long drawn out taper where you expose yourself to the benzodiazepine or Z drug even longer. That may be contraindicated. You may be able to get off, quickly without issues and not continue exposing yourself to the drug. This is a big one. Like I said, I made this mistake. I thought, it was similar thinking along the lines of if you're ingesting a poison, like if you just get it out of your system, then that's going to be the solution. I even told my job, like I would be back in 30 days or something like that. And that was in 2010. And I've not been back to work since. So I can tell you that getting the drug out of the system in a lot of cases does not heal you, and it's not the answer. And also, if it were true, tapering would be unnecessary. Everybody would just, get themselves off the drug and that would be the end of it. I try to explain it to people like the benzodiazepine is necessary. It's the sort of thing that's holding your nervous system together because you've become neuroadapted to its presence. You've taken it for so long that your body has changed around it being there. And so we have to imagine the drug as like a catalyst. So each tiny little amount that we remove sort of sends a signal to the body. Like if it could speak, it would say like, hey, a little bit of this drug is missing. It's time to upregulate some receptors and compensate for it being gone. So we need the drug present in order for it to be that catalyst to nudge the body back into its old pre-drug state as we remove a little at a time. Sure, there's people who are having adverse effects from the medications. Some people, though, have to endure drug adverse effects in order to stay on the amount of medication that they need to be on in order to do a taper, because it's this dance between adverse effects and withdrawal. You have to sometimes put up with the adverse effects of the drug in order to keep yourself out of withdrawal, but just know that as the dose gets lower in your taper, the adverse effects will fall off. There are rare patients who are truly paradoxical to benzodiazepines, and in that case, it's a little bit more complicated, in which that it may be indicated for them to come off more rapidly, but that is, a rare percentage of people. I think a lot of people mistake withdrawal symptoms and adverse effects of benzos for paradoxical reactions sometimes, and it's just not. Believing that there's some doctor or medical provider out there that knows everything about tapering and withdrawal and who can just design the perfect taper for you, and they're going to just know it, and you're going to walk into the office. And unfortunately, I think if you are one of these people making this mistake, you are going to be sadly disappointed. The really good doctors know just enough usually to help you. The decent ones will listen to you, they'll prescribe, and they'll let you guide the taper. We call them withdrawal cooperative doctors. And most of them, unfortunately, know little to nothing, and they can have terrible tapering ideas, which can be super harmful. So you're going to have to be your own best advocate here, most likely, unless you find like the diamond in the rough. I think this one is important in the pre-withdrawal phase. Not addressing interdose tolerance or lopsided dosing or picking a stable dose before starting is a mistake. Interdose withdrawal can sometimes be fixed by a longer acting benzodiazepine, or if somebody's on a shorter acting benzo and they want to stay on the drug that they're on, they can actually dose the same dose that they were taking, but more times. They can break up the dose into more doses and help interdose withdrawal issues. Lopsided doses sometimes cause, like big peaks and valleys in blood levels. And sometimes evening those out by making your doses, like 3 doses of the same exact amount, sometimes helps people feel more stable. And then by picking a stable starting dose, I mean, I've met countless people who are just kind of like taking PRN doses, or, on one day I was taking this much Ativan and on another day I take this much. And before you start a taper, you're going to have to find a stable starting dose where you feel comfortable, you're not in terrible withdrawal, and that will be the dose that you're going to take every day and maintain as you get prepared to start your taper. Next is maybe people who know that they need to taper, but they do too big of a start. So it's like they're just, instead of dipping their toe in the pool, they just dive in head first and do like a giant belly flop. I always tell people, like, we don't know if you're going to be somebody who struggles with a bad withdrawal syndrome, but it's better to just like start low and test the water, see how your nervous system handles a small reduction first. And this is because it's once people get dysregulated, once they kick off a withdrawal syndrome by making too big of a reduction, sometimes it's not so easy to reverse that or undo it. I've seen people who start a withdrawal and they think, it's okay, I'll just add the dose back and up dose, and that'll solve everything. And it doesn't always. There are people who add the dose back, and sometimes even more than what they started with, attempting to get stable again because they made too big of a reduction. And it either doesn't work or it doesn't work right away. And they're miserable and suffering for many months, holding and waiting for stabilization again. So it's best to just avoid that in the first place. And then this one, thinking slow is something that isn't actually slow. I mean, I hear people all the time saying like, but I tapered slow. And I don't take that at face value until I have them define what they mean by slow, because your definition of slow and my definition of slow could be two completely things, like, I took a month and I cut it into 4 pieces once every week. Well, we know that isn't slow, most of us. So you have to figure out what people's definition of slow really is. We know in the literature and in some media reports, they say that, oh, withdrawal is mild and brief and nothing to be worried about. So we definitely, when we're in this phase of withdrawal, don't want to believe that. It could be mild and brief. It could be non-existent for some people, but for others, there's a significant portion of people where it is severe and it can be long enduring. And so you need to be prepared for that. And not just think like, oh, it's, I'm going to push through all this suffering and it's going to be over in 2 weeks anyways. So, that isn't the case for a lot of people. And then the last one, this one drives me crazy. People who want to stick to a calendar. They think like, well, I have to be off for, Christmas or my son's getting married. And the body just doesn't work like this. It doesn't care about your plans. It doesn't care, about your wishes. And I want this to be over by whatever. In order to have a successful taper, we have to take signals from our body. Our body is what's going to guide us and let us know how fast we can go and when we can be off. And so, it's best, I think, for people to I tell them, just throw the calendar out the window and you'll be done when you're done. This one drives me crazy too. And the doctors are like so notorious for doing it, just pulling some arbitrary percentage out of the air. We have, anecdote, we have guidelines for what works for some people, because we've had all of this, people sharing in the groups and that kind of thing. And that's why they come up with like most people can get away with 5 to 10% in a month, but that's not everybody. And so some people may only tolerate 4% a month. Some people may only tolerate 2 if they're really super sensitive. So you don't have to stick to these arbitrary percentages. You find your sweet spot, you start low and you find the spot of a percentage that your own system can handle when you're tapering. Again, the body is the guide here. I hate the saying symptoms are a sign of healing. I can understand why people say it, like maybe in the protracted phase, because they're trying to encourage people like, yeah, those symptoms are your body's like repairing, because, they're giving people hope. But I don't agree with that when you're in the tapering phase, because the symptoms are the things that the signals from the body that we need to pay attention to. When you are making reductions, if you are getting worse or you are feeling withdrawal symptoms come on, they are not to be ignored. They're not to be seen as signs of healing. You're supposed to heed those. You're supposed to stop reducing, hold, maybe consider dialing your taper back some. I think people can control the severity of their benzo withdrawal syndrome in the tapering process if they listen to the body's signals and adjust accordingly. Sometimes your body just needs a break. Sometimes holding and doing nothing is the best, most successful plan. I talked to some psychiatrists in this space who see patients all the time who are very withdrawal wise. They're basically, some of them are one of us going through withdrawal themselves. And they say like one of the most frustrating things they encounter with their patients is trying to get them to just hold and give the nervous system a break. And the patient won't do it. They want to, oh, I have to do this, right? Sometimes you just need to just do nothing and let your nervous system chill out. Another mistake is maybe if things aren't going well or what you're doing isn't working, not considering switching to a different method or plan. I personally think that microtapers are, top of the list when it comes to the best, most tolerated, successful ways to get off of this. So if you're doing a dry cut, percentage cut and hold taper, there's other options available to you. You can, if you have a sensitive system, switch to a microtaper and see if that serves you better. if you're on a shorter acting drug, you can try crossing over to a longer acting one. So don't just say, stuck in your plan if it's not working. And then black and white absolutes, which if you guys have been in the withdrawal communities at all, I'm sure you've heard these. I also can't stand them because, again, everyone is different. No one should updose or no one can benefit from a reinstatement. I think hearing these things back in 2010 when I first joined are sort of what scared me into not doing what I should have done for myself. I do think updoses can help people in some circumstances, and I do think reinstatements can help people in some circumstances, especially people who have just in this, beginning phase of tapering, if they've cold turkeyed and they're, in the early phases, can certainly reverse the cold turkey and get stable and then go on to do a taper again. I've seen it happen before. So we shouldn't just make absolutes or believe them because, there are people who have had success with updosing and reinstating. And then just not managing our expectations and assumptions. I mean, for some, this is a long journey. So we just need to let go of expectations that things are going to go this way or that way. This can be nonlinear, it can be long, it can be hard. Also, though, this is going to be annoying because a lot of these things are like, well, this can work and that can work. And that's the challenge of being in a difficult situation with these medications. Some people regret updosing and reinstating. They think it didn't work for them or it made them worse. And that's also a reality. So when you're making these decisions in the tapering and withdrawal phase, it's not something to be made lightly. You need to research and make sure you're informed about all the possible outcomes of reinstating or updosing if you're going to consider it in your own situation. Some people who reinstate also or updose, they feel better in that moment, but then you have to go on to taper again. You are going to have to eventually come down if that is your ultimate goal, and that may not be easy. So something to consider. Drinking alcohol, recreational drugs during tapering withdrawal, adding other medications and supplements sort of haphazardly or not having researched them first. I know so many people over the years that I've been in the groups who just innocently tried taking something because they had, like an infection and they didn't realize that fluoroquinolones were, potentially harmful to somebody in benzodiazepine withdrawal, or they took a ton of supplements because they paid to see like a naturopath. And then when they tried to stop taking them, they had horrible withdrawal activated again. So it's very important to be cautious with things that you're adding when you're in the tapering and withdrawal phase, and just do your research. There's lists, over at Benzo Info Coalition of things that anecdotally we know have been reported to us to cause issues in withdrawal. We know things that are GABAergic, which are on the list, which are like high offenders for causing issues, quinolones, that kind of thing. And then in tapering and withdrawal, just forgetting to implement your coping mechanisms or symptom management techniques that you planned for in the pre-withdrawal phase. Make sure you lean on those heavily when you need them. All right, so mistakes made during the post-withdrawal protracted period. So you're done tapering now, or you're off the drug, or however you wound up being in the post-withdrawal protracted. Maybe you rapidly tapered and decided to stay off, or you cold turkeyed like me. So this one is another pet peeve of mine. You have to be off everything to heal. Some people I've seen really damaged by this. They're maybe say off of their benzodiazepine and they are in protracted for like a year or something and hanging on, waiting for the nervous system to recover from the benzo withdrawal. And somebody comes along and says, well, you're not going to heal as long as you're on Remeron. That isn't going to happen. And so the person panics and then they suddenly start coming off of the Remeron, or they rip themselves off of Remeron too. And in my opinion, you're already asking your nervous system to heal from one insult, from the benzodiazepine injury. And now you're going to go and ask it to do something else. Again, this sort of goes back to the thing where I was talking about, the benefits of holding and just sometimes doing nothing for people. Sometimes just leaving the other drug or drugs that you're on alone, unless they are causing you, paradoxical problems or severe adverse effects when you're dosing, and just not asking any more of your nervous system in that phase. Just let it heal from the benzodiazepine withdrawal, and then you can address the other medications at another time. I've seen it happen plenty of times where people take that path and they're so glad that they did, because they do recover from benzodiazepine withdrawal while they're on other medications, and then they can go on to taper the others slowly. Chris Page, who was a guest here, I think prior to me, is somebody who had that exact story. He completely healed from his benzodiazepine withdrawal while still taking Seroquel and Remeron. And now that he's functional and stable and doing well, he's addressing those in a very slow microtaper fashion. So people do heal on other medications sometimes. Again, the reinstating thing, it can help people who decide, in the post-withdrawal phase that they went too fast, but it can be detrimental and harmful for some people and they regret it. So do your research before making that decision. Comparing with other people's timelines. Oh, this is so hard. This is, part of the reason why those of us in Protracted are afraid to share, because we don't want to scare anybody else. People hate my story because of how long that it's gone on for. And I always find myself saying to them, like, please don't compare yourself to me. I've been around since 2010, and the people who are still here now that I met in those years, I can count on like one hand. Most people, the majority, if we're going to deal in percentages, are back to life. They get better much faster than my timeline. And so it's such a waste of just emotional energy and distress sometimes to compare yourself and panic because I lasted this long to think, oh, well, that's going to be my story, because typically people are heal much faster than I did. And again, the way we got here is so different. The drugs we took, the timelines, the doses, the methods of coming off, etc. It's just not possible to accurately compare. Again, this is the same one. So in tapering, it's a problem. And in post-withdrawal and protracted withdrawal, it can be a problem. So be very cautious about new things that you're introducing into your system without researching them first, or trying things very slowly. Everything we do when the nervous system is dysregulated from benzos should be very slow and cautious and low dose, and just make sure you're not, again, that diving into the pool head first thing. Like, just let's dip our toe in and be very careful and see how we respond and react to stuff. This one, the magic bullet or the cure. Whoever comes up with this is going to be filthy rich, because it just doesn't exist. And so many people want it. It's not out there. Like I said, the best chance you have is going back to that pre-withdrawal phase and getting really super prepared and doing a really cautious taper and listening to your body. And I think that's as close to the cure, or like the most control we have over benzo withdrawal and its symptoms. But once you're sort of, in the withdrawal and in the post-withdrawal phase, there just isn't a magic answer. And so acceptance and learning to cope is very, very important. This one, oh, I've seen so many people suffer from just this thing that their mind does to them. They just convince themselves and believe that they're the worst, that no one's ever had it this long, no one's ever suffered in this way, that they're somehow like unique and different, and they're the exception to the healing rule. And it's just not true. I mean, I've had people contact me over the years and be like, this is going to be new to you. You've never met anybody with this. I'm the only one who's had it. I can't find anybody. And they tell me, and it's like some super common symptom that I've met countless people who've had. I think it's a symptom of benzo withdrawal. I don't know that we, convince ourselves that we're this just exception or something. It's a big mistake in post-withdrawal. And also when you're tapering too, is not getting examined for other medical problems. I've seen some people say like, oh, I'm in withdrawal, so everything is probably a withdrawal symptom. It is possible to have other medical problems going on simultaneously while you're tapering or you're in protracted withdrawal. And so it's, important to get checked for things and make sure that everything medically is okay. A lot of times when it is withdrawal, people will get a clean bill of health, and then you can also have, just peace of mind that nothing else is going on. At the same time, however, there's people who just invest so much money and time and energy into like chasing these medical rabbit holes, convinced, that they have something else wrong, and it can be like a huge waste of money and time and emotional distress. Some of it is probably like a benzo withdrawal symptom of health anxiety or something like that. So resisting acceptance, like I said, the magic bullet isn't there. If we don't accept that, this is unfortunately the path that we are tasked with taking, it's going to be a heck of a lot of a harder road, because I think acceptance is a requirement. This has happened to us. It's going to suck in some cases. There's going to be symptoms. It can, be longer than we want it to be. But, if we want off of these medications, what other choice do we have than to accept? And then a big one is just patience. And it's if you're in protracted, it is something required. I mean, this can take a long time for some people, and it is frustrating. We lose a level of functioning and access to the world that we were accustomed to before this happened. And we're just unfortunately having to be patient and just know that, healing comes in time. It's not always linear. And we're just going to have to accept. Again, the same. Don't forget to use your coping mechanisms and symptom management techniques all throughout the post-withdrawal and protracted period, because those are what are going to get you through and make it so that you can continue to carry on and cope. All right, so mistakes made reintegrating. This is the part where people are getting back to life when they're starting to feel better. Too much, too soon. I imagine, and I've seen it happen with people, like you've been almost in this like prison with benzo withdrawal, right? And you just want to get back to life. Oh, you're just chomping at the bit, and you take on way too much. I remember one of my benzo friends, like he was ready, raring to go, and he scheduled like 5 concerts or something back to back on this road trip, and then called me from the hotel room, like shaking and quivering in the room, and, sort of in this little bit of a setback because it was just too much. So it's like maybe one concert, closer to home, like start slow again and just ease yourself back into activities and see how your nervous system is going. Not knowing your limits or pushing too hard, saying yes to things, or think about like maybe one of my desires when my body feels ready is I want to get back to the gym. Like I'd like to start lifting weights. So I'm imagining somebody just in the gym, like gung ho, I'm totally deconditioned from so many years of being in withdrawal. And so I really need to make sure that I don't go in there like I'm some, weightlifter who has been doing that, because I haven't in the last, 13 years. So we don't want to push too hard. Not letting others know that you're still struggling. People sometimes will see you doing well and assume that you're good to go. I have noticed this in my protracted period too, where if you don't speak up, people think that, oh, everything is just fine, so make sure that you inform those around you, like, yeah, I'm able to come now and I can do this or that, but there are still issues ongoing and, my nervous system is still healing. And so be patient with me. This one I'm guilty of is, being bad at saying no, or just maybe don't commit to something. Just say, I'll see how I feel. And then when the time comes, you can make the decision of if you're ready to do that or if you need to say no. All right, so this one, mistakes made overall. So this is sort of like the dump slide because they kind of can go with any phase of withdrawal. Using the wrong language. This one is so important. Like all of us need to start using the proper language. I think this is one of the biggest things that gets benzo withdrawal misunderstood, is calling it addiction when we're not really talking about addiction or saying like, I was addicted to my benzo. Even though you may have felt that way, there are definitions for these words that mean things. And so when we don't define them properly for the public or for our doctors or when we're doing media interviews, I think it's a mistake because we just cause so much confusion in people. So I would say look up the definitions of addiction and physical dependence. Even calling it withdrawal after a certain period of time confuses people. And there's been a lot of discussion about that in the communities as well. That's why they've come up with a new term called BIND, benzodiazepine-induced neurological dysfunction, because when you use the word withdrawal, for some reason, the medical community tends to only think of that as something that lasts for 2 weeks and then goes away. So I think our language is so, so important. We can even use the word neurotoxicity. I think that's more appropriate than the word withdrawal. So yeah. Using correct language. Talking about suicide to the wrong people when you're in this. It's such a sticky subject because people in severe states of benzodiazepine withdrawal need to be able to express that they're feeling suicidal without having the cops called on them. I think one of the best things my family did for me is when I would scream that I was going to kill myself or express that, they didn't call cops, they didn't call an ambulance, they just allowed me to get that out. And same with some of my benzo friends as well. But I understand like the complications of it because some people are like mandatory reporters, like if you're a therapist or something like that, or if you're really terrified that the person is going to kill themselves, then you feel like you have to intervene. So it's a difficult situation. But if you are just needing to express that you don't want to be here anymore because you're suffering so bad and you're not actually going to act on it, you can put yourself in harm's way of, being locked up against your will or put on more medications or something if you talk about suicide to the wrong people. So I would say just keep that in mind. Lawsuits. So I've just seen on Dr. Whit Daring's website or YouTube channel, that there's been a successful benzodiazepine lawsuit. And one of the things that the lawyer there said was a huge mistake that people could make if you are going to have a successful lawsuit is letting the statute of limitations lapse. So if that is on your list of things that you want to pursue, make sure that you know the statute of limitations in your state. And don't let them run out before securing a lawyer and filing a suit against your prescriber or whoever you're suing for this. Disability, a lot of people need Social Security disability, or they get disability from the previous job that they were working as one of their benefits. Make sure you're aware of timeframes. With those, it can take quite a long time to be approved. So it's better to apply as soon as possible if you can. And lawyers can help your case be successful. So, it may increase your chance of being approved if you get a lawyer from the start. Otherwise, they can deny you. You can appeal the decision and get a lawyer. But again, all of that draws out your ability to be approved for disability. And if you're sick in benzo withdrawal and you have no money or income, it may be better to get the ball rolling fast. Making big or life-altering decisions at any phase in withdrawal. I think a lot of people are altered by the medications. They, are not good at decision making. They are being driven by anxiety, or they have like a deep, dark, gloomy cloud over their head from feeling awful from the withdrawal or the adverse effects from the medications. And so like deciding that you're gonna end your marriage or something in withdrawal is maybe not the best decision. I think, you have to consider the effect that the drugs and withdrawal are having on you, and then see if you can get through until the other side before making big life-altering decisions. Getting deep into emotions and trauma in therapy and during withdrawal. Like I said, again, the emotions can be all over the place. We know of neuro emotions that are generated from withdrawal. And so I don't think it's beneficial to like start doing a deep dive into your trauma and your back history and everything. It's best just to, focus on coping and having support. Maybe a therapist could support you in the withdrawal, but you don't have to exhaust yourself so emotionally in therapy during this phase of things. And if there's stuff left over when you're better and healed, then you can get a therapist and you can start doing some of that work that requires, I think, your emotions to be yours, not hijacked by benzos and benzo withdrawal. Not being open with people about how bad things are. Again, I think people can't help you unless they know what's going on. That's not to say that everyone's going to believe you or just jump into action, but the ones who are going to be in your corner and going to be your support people, they can't help if you're not honest with them. So you should tell them what you're going through and give them the best chance of knowing how to help you. And then not believing in yourself is a huge mistake. You can do this. Lots of people have done it. There are people who are successful at coming off benzos every day, all the time. So don't fall into that trap. Not managing your limited energy well or prioritizing tasks. Sometimes in certain days, people can only do one thing. And if it's choosing between, going to the grocery store so that you can eat or going on a walk, you may have to just only choose the grocery store for that day because that's all you can manage, and that's okay. A big one is not setting up your environment for success. So, if you need sleep hygiene, for example, for me, I invested money in a good mattress, in blackout curtains, in super comfortable, cozy sheets and pillows and a fan, a yoga bolster. So I think having tools and things around you that can help you is really important. And you can set up your environment for success. You can have a peaceful, calm, soothing place, hopefully. I mean, I know there are some people who just don't, they don't have resources and they don't have a choice. But if you can, setting up your environment is super important. Getting too far ahead of yourself or not staying in today. All we have control over is today, this moment really. And, I've seen people just spiral down that train of they're thinking so far ahead. And it's just not serving you. It's not useful. All of your anxiety is caught up in this thing that may not ever happen, So I tell a lot of people that I'm helping or supporting, let's just worry about the next 30 minutes or the next hour. What are we going to do about that instead of this thing that you're catastrophizing over months or years from now that just isn't important or that may never manifest. And again, the same thing, losses, that's stuff that's in the past. It is so super painful. Some of the things that people have had stolen from them because of benzos or lost, but it's just out of our control. It's nothing we can do about it. And so that goes again back to the acceptance piece and, just grieving those losses as healthily as possible. And some of that may come after healing when your emotions are intact and you can, like I said, have therapy and that kind of thing. All right, support groups. So not being able to discern between good, safe, and bad, unsafe advice. This is so, so important that you are your own best advocate, that you do your own research to know, okay, is somebody telling me something that's even true, Again, those absolutes or somebody who can predict an outcome for you. Usually those are people to stay away from in support groups. There's nothing really black and white. Tapering and benzo withdrawal, all of it is, sort of a trial and error type thing. Like this works for some people anecdotally, you could try it, but it may not work for you. So and predicting outcomes, like nobody can tell you this is definitely going to help you or work for you. So be cautious of anyone who makes those type of statements. And I think staying in them too long or spending too much time in them can be detrimental. So make sure you're managing your use and that it's healthy for you. At this phase in my withdrawal, I'm not in any support groups anymore. They don't serve me. And it's more distressing for me to see that stuff in my feed constantly. I still do my activism and I still work in the space, and that's okay for me, but I can't be in support groups. So I knew that about myself and I got out when I felt like it was that time. Not finding withdrawal buddies. I think it's so important because the people in your life who are healthy and who are your real family and friends, they only have like so much availability, time, or even like emotional capacity to be able to support you. And so that your withdrawal friends are the ones who are going to really have time and empathy and firsthand knowledge to be able to provide you support. And you can have so many that you can spread your misery sort of around. And so that not one person totally becomes overwhelmed with supporting you. And then finding the wrong people, just be careful in support groups. There are people who are really, really sick from benzo withdrawal and they can't help it, but their moods are dysregulated. And then, you can become upset because someone else is super upset and you feed off of other people's energies and emotions. And I've also met other people who became victims of people in support groups too, like developing what they thought was a relationship with somebody, and then it turns out this person was lying and they weren't who they said they were, etc. So it's still the internet, and be careful. And then this strongman contest stuff that goes on in support groups sometimes, where it's like, just stick it out, the sort of like badge of honor of suffering. And I just think that can be super harmful to some people. I think that's part of the reason I stayed in the cold turkey when I could have reinstated right away, because I was getting that sort of messaging, like, just be strong, you can do it. And sometimes that isn't the answer. Sometimes that is not smart at all. All right. Mistakes with others, trying to convince other people. Gosh, this can be wasted energy. One of my favorite writings on this is over at Mad in America. It's by Matt Samet. It's called Lay Down the Burden of Proof. And there's a quote in it where he says, like, if you don't believe me, goodbye. That may be too harsh, because some people do, like your family needs education, your friends, they need some convincing sometimes. But after a while, it's like you can just invest so much energy that you don't have that could be better invested in yourself and your healing process, in just trying to get other people, your doctor, whoever, to validate or believe that this is real. And you may never get that from some people. So you're going to have to just let it go, hoping or wanting those who haven't had it to fully understand, you know, the depth and the texture of what it's like to go through benzodiazepine withdrawal. They simply cannot. It's not something that they can try, and they can get as close as we need them to be able to support us in the way that's beneficial, but they can't ever fully understand unless they've lived it. And that's why your withdrawal buddies are so important. Holding resentments for too long. You know, I think some things are unforgivable, like doctors who, you know, you have gone in and tried to show them all the information about benzodiazepine withdrawal, and they just gaslight you and flat out refuse to read it or believe you. I think that is sort of unforgivable behavior. Maybe some things in your family or friends, people just, you know, did to you, and you hold resentments. But for the most part, I think like most people don't mean harm. Most doctors don't mean harm. Your family's doing the best they can to try to support you in this. And anger is such like a bitter pill as well. It can eat us up and it can destroy us. Some of it is even just physiological. You know, benzo causes anger and rage. And so it may just dissipate over time on its own, which I've seen happen in so many people who were so angry. And then as they healed, it just sort of got better. But, you know, a lot of them wound up forgiving family members for just not knowing or understanding how to be the best support to them at the time. And for me, all it takes is like an apology. And, you know, I remember my parents saying to me, like, we just didn't understand how sick you were. Like, that was enough. And then I could let go of, you know, how angry I was. Dating and relationships too soon. These can be super stressful. Anyone who's ever been in a dating relationship knows. And so maybe your nervous system just isn't ready for that kind of thing just yet. You know, make sure that you're ready for these types of interactions with other people before you get caught up in them. And then you realize, oh my gosh, this is like causing so much stress to my nervous system, and I shouldn't have done this yet. And handing over your health medically with blind trust. You know, we learned the hard way what that can result in. And so you have to be your own best health advocate here. Setting boundaries, super huge and important with other people. You know, like, this is what I can tolerate right now, and this is what I cannot. And just making sure that people are respecting your boundaries, having safe people in this, because stress, drama will upset your withdrawal and make it so much harder to heal. So surround yourself with other people who truly have your best interest in mind, who are looking out for your health and well-being. Choose your people wisely. Okay, with yourself, not taking care of your body or your overall health, I'm a huge believer that, like, we're asking something huge of our bodies to heal us from benzodiazepine withdrawal, this major insult. And if we're eating, you know, sugar and tons of processed garbage and soda and all of that, and smoking cigarettes, and, you know, I just feel like we can give our body a better chance by treating it right. Again, this was listed before, writing everything off as withdrawal. Make sure that you are, you know, respecting your body and making sure that you're checking for other medical issues just in case there's something going on simultaneously. Being too hard on yourself. So many people just, you know, should have done this, or I shouldn't have done this, or I should have never taken these medications. I should have known better, or I'll never get through this. You know, I'm not this or that. I think sometimes we can be our own worst enemies, and it's so important to just give yourself credit. Benzodiazepine withdrawal is so hard, and you are so strong. Like, this group is called, you know, Benzo Warriors for a reason. Don't believe the lies that your brain tells you in withdrawal. And it's so many. The brain is such a good liar in withdrawal. And so I know it's so hard, because a lot of times the feelings and the things generated from benzodiazepine withdrawal feel real. But if you can really get grounded and say, like, okay, this is just my benzo brain lying to me, I think you can do better at ignoring those things that are lies. And then passing the time constructively, so huge for me, like distractions, getting involved. That's why I'm involved in so many things, because that was like my sort of withdrawal coping, is to just have things that I could do to be a productive person and pass the time waiting for healing. And make sure you ask for help. Make sure people know when you need it around you. There are people who will step up and help you, but they don't know to do that unless you ask. We've done this one: overdoing it, pushing too hard, listening too much to other people, not trusting your own instincts. I think that's a huge mistake. Like I said, I had that big feeling before I checked into detox, like something isn't right here, and I ignored it. You know yourself, you know your body best, so you be your own best advocate. And then for some people, I think it's a mistake to believe that they were ever like disordered or damaged in a mental illness sense, like for why they took these medications in the first place. A lot of people took them for regular, everyday things. And so this whole labeling of being damaged or disordered is just not appropriate. And they were misdiagnosed. All right. The biggest mistake, I think one of them is losing hope, or believing that you're like unique and too damaged to heal or improved, improve. Like I said, I've seen so many people in the years that I've been here get better. And, you know, one of the biggest pieces of advice when I ask other long-termers, like when I interviewed Samet recently, like, what would you have to say to people going through benzo withdrawal? What's your biggest piece of advice? And he was like, don't kill yourself. Don't lose hope. Don't give up. And don't think that you're too damaged to heal or improved, because statistically, when we look, that is the outcome for the overwhelming majority of people. So it probably is going to happen for you too. Another is failing to learn from this. I think with suffering comes great lessons if we're willing to learn and embrace them. Like the thing I said with taking care of your body or eating, like we've been given sort of this lesson that if we don't take care of our bodies, like health is all we have nothing else if we aren't healthy. And so we can do things and change our lives in ways from this, and use it sort of as a tool to go forward and be better people and treat other people better and treat our bodies better. So I think there's huge lessons to learn from benzo withdrawal. And lastly, just thinking that you won't make mistakes is a huge mistake. All of us are going to make mistakes in this. Don't get too hung up on them. Like what's done is done, and just, you know, keep going in spite of the mistakes that you've made. Keep going. That's it for me.
Awesome,
Thanks,
Nicole.
everybody.
Thank you so much. Your story is amazing, and you've lived through so much. You have such an incredible experience to draw on to teach and help so many people. And we're so grateful that you came and shared your story with us. And I'm grateful for all the advocacy and the awareness and the, to use your term, activism that you do on behalf of the benzodiazepine community.
Thanks, Lisa.
Thank you.